Hey, Linda.
Hello.
Good afternoon. Good morning, everybody. Welcome to this week's edition of Digital Health on Air. My name is Aditya. I'm one of the founders and CTO here at Luma. Today, I'm joined by Linda Stevenson, who is the CIO of Fisher-Titus in Ohio. Linda, thank you for joining us today.
Thanks for having me.
I would love to kind of kick our discussion off, which is going to be focused on rural healthcare and providing services to rural communities, with a little bit more about you, Linda. You have a really interesting background. Your path to Fisher-Titus, I think, is really fascinating. And I'd love to just get a little bit about your background, start with a little bit about your role and kind of how you got into it.
Yeah, well, first of all, I'm the CIO here at Fisher-Titus Health, which is for those who don't know, it's Northwest Ohio. You might know Cedar Point is the roller coaster capital of the world. We're at 20 minutes from Cedar Point. It is rural in very much a farmland area that we're in, and Fisher-Titus is a 100-bed hospital. We may be small as a hospital, but we're kind of wide in terms of our services. We have nursing home, home health, we have senior living, we have our own EMS, we have ambulatory physician group. So a lot. We like to say that we can provide services from birth all the way to death for our patients. So, and that's kind of how we view it. We're here for your life.
About how big is your catchment area? Like, both patients and kind of, is it like multiple counties, one county? Like,
primarily Huron County, but we get surrounding counties as well. So I would say probably about 3-4 counties in total. But we're surrounded. We're about an hour from ProMedica and about an hour from University and Cleveland Clinic. So kind of circled by these very large
giant systems. Yeah, definitely. And tell us a little bit more about your path to get to Fisher-Titus. I think you've been there about 5.5 years, but you kind of did some work at Cerner before, but you've also been in clinic or like easily in like a more clinic-oriented setting. Would love to hear kind of about your background and what got you into Fisher-Titus.
Sure. Well, the really cool thing is way back in the day, I started as a biller. And,
oh, no way. Okay.
Hospital in Cleveland. Yes, my first job was a biller. And I think I asked too many questions when I was in that department. And they said, boy, she asked a lot of questions. And that lends itself to being in IT. And there I was ever since. But I have spent quite a bit of time in many Cleveland hospitals. But I did about 11 years at the Cleveland Clinic, rolling out the Epic system to all the regional hospitals back in the day. I started in the regional area, then went to the main campus. From there, spent 11 years at Southwest General, which is another community hospital in the Cleveland area. And during that time, they outsourced their IT department to Cerner. And so I became one of the leaders in IT at Southwest as part of the IT works.
It's kind of like a liaised or like a seconded group, right?
Yes. Yeah. So I worked for Cerner for those years, but was physically at, of course, tied to, paid for by Cerner, really got to experience that, but primarily responsible for Southwest.
Oh, that's incredible. So, I mean, asking the questions are like, okay, well, you seem to care a lot of this computer stuff. You go fix it.
Yeah, kind of. Yeah.
I love it. I think that's, that natural curiosity. I find it like a lot of CIOs I talk to, it's like, well, how do I do this? How do I make it better? And I think, looking at Fisher-Titus, kind of what you guys have done, I think one of the things that stands out is like your commitment to the community, work that you guys have done. And I think one of the things that I learned was that you'd partner with the state of Ohio on neonatal and prenatal care and that sort of stuff. I'd love to kind of just hear a little bit more about how you engage with what programs you guys built, and obviously what technology you kind of used to make that happen.
Well, a couple of things. So we have some grants and programs that we partner with the state of Ohio purely from a services perspective, making sure that we are tied closely with the state to provide better prenatal care. And they're not from a technology perspective, but we're also very closely linked to the CliniSync HIE and its offering for the state of Ohio. It's one of the most robust HIEs in the country, to be honest with you. I'm on their clinical advisory board, and we work closely to say, well, what is the next big thing? Yes, we can exchange a CCD document or continuity care across that, but that's just a piece of the pie. So what do we do next? How do we exchange maternity care records next? And make sure that maternity services out in the community physician office that information can flow to the hospitals where they might deliver and need that care. So, and then we also work for even countywide, statewide grants in terms of how do we partner to make sure we have the technology for our maternity patients.
And when you're thinking kind of about providing these services, both in partnership with the state, but also, just good service to your communities, how do you think about like taking that through the lens of like, there's a ton of things you have to do to make that happen in the real world. And you're saying like, we're not just exchanging CCDA, we're actually talking the entire maternal care record. Like where are you kind of pushing the envelope with your teams, kind of the community around you? Like, talk to me a little bit about kind of how you're pushing that envelope.
Well, I think that's an example, a real example of where we're pushing the envelope.
Yeah, I'd love to hear it. Yeah, totally.
Working with the state to say, look, we appreciate the work you're doing, and it's so helpful to our patients, but we need to take it further, and so we're working with partnering with CliniSync to develop, if you would call it a maternal CCD, I don't know what you want to call it, but here's the specific records and tracking that we need to have for a patient when they arrive at the hospital to deliver, and vice versa. When that patient goes back to their office and has delivered or wants to be referred out, how do they know what happened during the delivery?
Sure.
And then faxing pieces of paper, how do we electronically transmit that through the statewide HIE, have that a record no matter where they go, and then be able to get that integrated into the other offices.
As kind of a, you guys provide service in this like primarily farmland community. Like, do you find there's, you've also worked kind of like in Cleveland Clinic where it's like, much more urban. Mm-hmm. Do you find that the way you deliver care and the way that you deliver like technology to provide that care, or assist that care, I should say, kind of has any difference between the two ecosystems?
Well, two things. One, we are more nimble and agile because of our size, so that we can more easily turn on a dime and implement new things as they come up, such as AI solutions, for example.
Yeah.
By the same token, on the other side of the coin, our resources are more scarce.
Sure. Yep.
And we don't have the ability to do internal development, so we have to be much more willing to partner with vendors like you guys.
Sure. Yeah.
Say, hey, this is what we need. Let's partner in beta and test. So, I do the work with you to help you, and then that helps us to do things in a way that maybe we can afford them.
Yes, that makes total sense. And one of the things that's really important, I think, about, a lot of the healthcare systems we talk to and interviewees that we have on Digital Health on Air, they're work for nonprofits. And for some people, that means like there's a certain side of like opportunity and other side, a certain set of constraints. And I think kind of operating like a healthy health system, that's a mouthful, as a nonprofit can be challenging. But I think you guys have done a great job of it. Like anything that you guys are doing that makes that possible, especially in your community outreach, kind of making that possible.
Yeah, I think we do a lot of unique things here. Number one, people need to understand, first of all, that there's, rural healthcare and community healthcare is bigger than you think.
Yes.
So in this country, there's over 6,000 healthcare organizations of this size, of this community and rural and critical access. Critical access is less than 20 beds. We're about 100 beds. So people don't think about that. They think about the big organizations.
Yes.
Right? So it's up to us to get creative, because with our margins of, let's say, less than 1% at the end of the day, what do we do to stay viable and stay on top of technology to bring things to our patients? So we partner. So I can give you an example right now. There's 4 of our community hospitals just in this area alone that have 4 what we call a consortium, and we do work together. So we might negotiate with a vendor for a better rate.
Kind of like a GPO type of thing.
Kind of, but it's with our 4 unique hospitals saying, hey, vendor X, we'd love to work with you. Can we get better pricing if all 4 of us select the same solution at the same time? And we have done a great job at saving in that way, so we can all take advantage of technology, but also, save cost.
And that's material to the bottom line, right? Like if you're working 1% to 2% margins, which so many systems are, like every $50,000 to $100,000, every $10,000, like in sum, it adds up to, basically a healthy operating health system.
Yeah.
Tell me a little bit more about like, what's, of the things that you've done, because it sounds like you've done a ton of innovative things. Mm-hmm. Anything that you're particularly proud of? Like, hang your shingle on that as your tenure as CIO.
Honestly, the stuff I'm most proud of isn't the stuff that's fancy. And
that's sort of the best stuff most of the time, right?
When I got here, I came, the Fisher-Titus has been known across the country for the very first smart room hospital in the country.
That's a big hospital.
Probably back in the 2014, right? People would come from all over the country to see the smart rooms and all the automation around the patient care. So when I got this job, I was very excited to be coming here. And I knew that, it had been 5 years at that point. I joined in 2019. And I got here and found that foundation was crumbling, that technology hadn't been upgraded, that the processes hadn't been developed, that optimizations hadn't been done. So I would say the first 3 years I got here was really about rebuilding from the ground up, infrastructure, devices, optimizing our software, and optimizing my team.
Yeah.
Sure, they had I brought to them, what's possible from the outside organization, because when you're in rural healthcare, it's people that have been here a long time.
Yes.
They love their community. So
they provide that service into their community too. Like they're patients, not just employees, right? Like they're also consumers of the same services that you might provide.
Yes, exactly. So my most proud moment is just the rebuilding of the team and the rebuilding of the infrastructure to make Fisher-Titus successful again.
So I think it's a really interesting story, or maybe even a parable out of that, which is, there's a moment in Fisher-Titus's history. It's like, yay, like, leading technology, healthcare organization. And then like, over time, digital cruft or whatever it is starts to build up. And, unless you do like a uplift, the things don't catch up and,
Right.
it kind of, the rubble continues to build. Do you find that if that is common, in healthcare, like unless you actively work to make it better, it doesn't get better?
100%. I think that's common. I think we go through these cycles where it's project, and we're installing and doing all the work. And then we haven't taken the time. Then afterwards, it's on to the next project and the next project, whatever those.
Yeah, exactly. It's like, when do we have time to ever go back and optimize?
And I don't go back and optimize.
Yeah.
And then people get frustrated and whether it's physicians or whatever, they don't take the time to really say, hey, we could be doing this better. So I think as a CIO, one of my jobs, one of my many hats that I wear is I have a PMP, and my job is to manage projects. And it's not just to make sure that we get the right resources. It's also to make sure we're doing the right thing at the right time.
Yes. Yeah, I think that's so important. Like in the CIO, especially in a healthcare role, you're responsible for the EHR, the CRM, the ERP, whatever it is.
All of it.
Like all those applications require really strong project management capabilities. Yes. So it might be worth talking, since you have that PMP background, is program management and process management a very well staffed out group in your team?
It is. It wasn't when I got here.
Interesting.
So I brought that PMP background and made sure that developed and brought in-house several people who are very strong PMs. We don't have as much program management as we do have, our PMs pull together all the projects to make sure we're resourcing right, we're prioritizing right, we're escalating right. And then not only that, but it's process improvement. So
yeah, it's that kind of look behind you were talking about, right? Like, yes. What did we do last year? Have we touched it again?
Yes, that as well as internal processes,
Oh, sure. Yeah, of course.
Change control right, is cybersecurity right, all those processes that are foundational to IT, not even the stuff the rest of the organization sees, but everything that we.
But that's 100% in your wheelhouse. That kind of that invisible work that has to make the the yes. clock tick and the trains run on time.
Yeah.
So one of the interesting things on your background, kind of in your role, it's you've worked at Cerner and but you've been a CIO, so you've kind of had the inside and the inside outside view.
Yes. Yes.
Where do you think about kind of how the technology stack needs to evolve? You're obviously leaning into some of that sort of stuff with process improvement, but you've been on the vendor side, you've been in the system side. Where do you think the technology stack needs to evolve to kind of support systems like yours?
Oh gosh, it's we're looking at a lot of the AI stuff, but I think where we need to get to is a point where vendors are working together. So everybody's got to think, I solved this problem and I solved this problem, and I could be sitting here discussing with vendors, till I'm done.
That could be your only job, honestly.
It could be my only job. Yeah.
For sure.
So I think, the better we can partner to solve problems rather than just bring software to find a problem is what we need to do. And we've got some opportunities there, but I think we haven't pulled it all together yet.
I find, a lot of conversations I have around AI are solutions looking for a problem.
Yes.
Problems looking to be solved. And I'm very unenvious of people in your seat because, there's people in my seat who are banging down your door to say check this out. Isn't this cool? But you're I have a health system to run in a rural community. that has like, on January 1st, I know December is going to be overrun because I've got people's premiums rolling over and that sort of stuff. And I'm just very envious, unenvious of people in your position.
Yeah. So I think one of the things I focus on is, there's a million vendors, like we said, who can I partner with? Who can be someone that sits with me and has the conversation about, what problems can we solve?
Yeah. And so one of the things, oh, sorry, go ahead.
No, it's okay. Go ahead.
One of the things is like in a CIO, you're not like your organization's distinct, but you're not an island. So you're probably talking to other CIOs, you're talking to other folks. I think, you're very involved in Chime. Like where else do you go to get kind of that peer group, like what's working for you, what's not working for you? Are you doing like Oracle conferences now? Like now that the Cerner conferences are, I don't know, like where are you getting that signal from about what's working?
I have so many. That's a lot of time that I spend, to be honest with you. I am a Gartner member, so I use my Gartner.
I've got like every box checked there.
Love Gartner, but I also love Chime. Different needs and different groups. So I stay really close to my Chime friends and colleagues. But I also really great about in the state of Ohio. I've made it a job of mine to talk to every one of the CIOs that I connect with over time, whether it's Clinton Clinic, other smaller organizations like Blanchard Valley in Western Ohio. So we stay close. Hey, what are you saying? Hey, what are you doing? Where did you go with this purchase or that purchase? And all of us stay in touch, even if it's just emails. So the Ohio.
Anything that you're going to fill in from the peer group that you work with that's like super exciting. They're like, like that is something we should look at.
I'm sorry. Can you say the question again?
Yeah. So like, talking to your peer group regularly, anything that you've heard recently in the last year where you're like, wow, that's a great idea. Software, process, building, tech, doesn't matter what it is. Anything.
Absolutely.
Like, wow. Yeah. I would love to see if that.
Down to RFPs. Hey, you used an RFP for this. I'm going to do an RFP for HRAS, for example. Can I steal some of your ideas? Can we share forms? Can we not start from scratch for all of us? Because especially in community hospital, that just saves us time, money, frustration.
Yeah.
And it gets to the root of where people have good vendor relationships and where you don't. Because I'm one of those people, like, I'm a referral person.
Yeah, totally.
We're a good partner. I'm referring you all day long, and vice versa with my colleagues. So we're real close in Ohio.
One of the things that I know about Ohio is there's so much healthcare in Ohio that there's actually 2 HIMSS chapters inside of Ohio.
Yes, like, Northern and Southern.
Yeah, and I'm like, this is unusual. I'm like, but like after I learned a little bit more, I was like, oh, this makes sense. There's just a ton of healthcare in Ohio.
There is.
When you're looking forward to the next year at Fisher-Titus, like what are you most excited about? Like projects, things that are coming online, stuff that you put into your like quarterly or annual planning? Like what's exciting for you for the next year?
I think the most exciting thing for me is some of the, and I know this sounds buzzword, but is some of the AI solutions, because we do have some very serious productivity issues in some of the areas in rural. And this is another thing that's unique to the rural healthcare, which I didn't realize till I got here, was how hard it is to hire. Because
on the physician side or everybody?
Everywhere.
Interesting.
Thank God, you'll never hear this again probably, but thank God for COVID, because it made that remote work the norm. And then
yes, not the first health system leader who said that on the hiring side.
Yes. And so it's enabled me to have more options for hiring, but that doesn't apply to all departments, because some departments, you have to be here, right?
Yeah. So like your rent staff or your whatever it is, like they kind of have to be here. Yeah.
People at the front desk have to be here to greet the patients. It's not going to happen by itself. But yet we struggle to find those people. And so we need to be prepared with the tools that optimize their work so that we can do more with less.
Yep.
Not because we're laying off people, but because we have a hard time hiring people.
Well, also, going back to the comment you made a couple minutes ago, like 1% margin, you just can't hire a bunch of people, right? Like it's just not an option, even if they were available, which is clearly the other side, the yin to the yang, right? Like you can't just hire your way out of every problem.
So I'll give you one example. Our lab automation. So we just did a lab automation line where all the tests are processed automatically through a robotics line. And that allowed us to get rid of 7 not phlebotomy positions, but lab tech positions, because we couldn't get that.
They're just sitting open on the rec sheet. And
7 open lab techs. Can you imagine how much work was not getting done and how much overtime is being done?
Oh my goodness. And I'm sure just, from the patient care side, it's just like tests weren't happening in the time that they needed to get done.
Absolutely. Yeah.
That's incredible. And so that's like an AI or an automation. I'm not going to say AI, but an automation that you've
Correct.
already deployed. What kind of other things are like yet to be done? Like, either patient care setting. Like one I hear a lot of people talking about and getting excited about is ambient scribes.
Well, we've been doing that for 3 years. These people are all behind the times.
This is, very much in the DNA of Fisher-Titus, right? Early adopter.
Yes, it is.
So
we're blessed to have
what else excites you?
Yeah, we're blessed to have a CEO that supports technology when appropriate, right? We don't just do it for technology's sake, but we did the nuanced DAX for about 3 years, and that was a great win for our physicians. We're now converting over to Suki, so that's something we're pursuing at this point. We're looking at some automated tools that are going to help with RPA for our rev cycle.
Sure.
Also looking at things to automate prior authorization for patients. It's getting more of a burden every day.
One of the running gags that we have here is at some point we're not going to need any healthcare interop. Just going to be robots talking to robots, and like that will be how it works. I'm like, it's an interesting way to think about it, because like prior auth, right? There's no standard for it in the world at large, and so
wouldn't that be nice?
Yeah, so people are going to solve it in other ways because the human capital problem is real.
Yes, it is.
So, I love these thoughts around kind of like, taking technology, being able to uplift it, making sure you continue to invest it, strong, project management foundation. Because ultimately, I think what you're getting at, Linda, is like the ability to service this community without having a ton of people. Like that's kind of seems like it's really core to how you operate as a CIO.
100%. We're very invested in the community. Well, we're the largest employer in our county. Yeah. So without Fisher-Titus, what would Huron County do, for all these employees that work here and all the tax dollars that come here and all the care that's given here? So it's everything we can do to be viable, whether it's cutting costs, improving revenue, and being out in the community and saying, what do you need?
Yeah. And active listening, right? Like understanding the needs of the community. And it sounds like kind of where we started our conversation, being able to provide better maternal care is a great example of how you guys make that real.
Yes. And, patient engagement is everything. I really, truly believe, and that's something else that we're really working hard on is how do we get the patients more engaged in their care, whether that's scheduling their own appointments, submitting their own information, pre-appointment, check-ins in their phones, all those things that just make it more convenient for them to want to come.
Yeah, because like you said, you're squeezed between two major players, and the more you can make a consumer experience for them, we were joking for anyone listening in the pre-call around the Domino's Pizza Tracker experience. Yeah. Healthcare is never going to be that easy, but wouldn't it be great if we could get a little bit closer to that experience?
I know, I sure would.
Linda, thank you so much for your time today. I really appreciate it. It was such a fun conversation for me around kind of how you guys are making incredible things happen in rural healthcare at Fisher-Titus.
Me too. Thank you for having me. I appreciate it.
It was a real pleasure. Enjoy your day.
Take care.